Let's talk about the future of breathing. Not the act itself, but what we can put into that breath to heal the most difficult diseases known to medicine. For decades, pulmonology has faced a brutal paradox. The lungs are designed to keep things out. They are a fortress protected by sticky mucus, cilia that act like constantly moving brooms, and a complex immune system ready to attack intruders. This makes treating lung cancer, cystic fibrosis, and pulmonary fibrosis incredibly difficult, because getting drugs past those walls is a logistical nightmare. But right now, there is a paradigm shift happening in nanomedicine. It is not happening with a pill, and it is not happening with a needle. It is happening in a mist. We are talking about inhalable exosomes. This is the deep dive into how naturally engineered nanobubbles are rewriting the rules of lung therapy. To understand why this is such a massive leap forward, we have to look at what we currently use. You might be familiar with lipid nanoparticles, or LNPs. These became famous during the pandemic because they were the delivery vehicles for the COVID-19 mRNA vaccines. LNPs are triumphs of chemical engineering. They are tiny balls of fat designed to protect a payload. But here is the catch. To your body, an LNP is a foreign object. It is a synthetic invader. The immune system often recognizes it as such, triggering inflammation or clearing it out before it can do its job. Now contrast that with an exosome. An exosome is not synthetic. It is biological. It is an extracellular vesicle, a tiny bubble measuring between 30 and 150 nanometers, naturally secreted by your own cells. If cells are cities, exosomes are the postal service. They are the encrypted direct messages sent between cells to coordinate behavior. Because they are natural, they don't trigger the same immune alarms that synthetic particles do. They are the ultimate stealth couriers. But the magic isn't just that they are stealthy, it is that they are smart. This is where we get into a concept called tropism. Tropism is the biological ability to turn towards or aim for a specific target. Research has uncovered that exosomes derived from specific lung cells, like bronchial epithelial cells or lung spheroid cells, have an innate homing mechanism. They want to go home. If you inhale them, they don't just float around aimlessly like a chemical drug. They actively seek out the tissue they came from. This return to sender mechanism allows for a level of passive targeting that chemical engineers have spent decades trying to mimic, with little success. So we have this perfect, natural chassis. Now bioengineers are popping the hood and upgrading the engine. We are moving from naive exosomes, those just harvested from cells, to engineered exosomes. This is where the science fiction becomes reality. Scientists are now genetically modifying the parent cells, the factories producing these bubbles, to display specific proteins on the surface of the exosome. Think of this like adding a GPS system. For example, by attaching a RAGE-binding peptide to the surface, we can force these exosomes to dock specifically with alveolar epithelial cells in inflamed lungs. Simultaneously, we can install cloaking devices. We can engineer them to display a signal called CD47. In the language of immunology, CD47 translates to "don't eat me." It tells the macrophages, the immune system's garbage trucks, to let the exosome pass, ensuring the payload actually reaches the target. And let's talk about that payload, because the cargo capacity of these nanobubbles is revolutionizing what we can treat. The most striking example comes from a 2024 study out of Columbia University regarding lung cancer. Lung cancer is the leading cause of cancer death, partly because the tumor environment shuts down the immune system. We have drugs to turn the immune system back on, like the cytokine IL-12. IL-12 is incredibly powerful. It wakes up T cells and natural killer cells to attack the tumor, but it is also incredibly toxic. If you inject IL-12 into a patient's bloodstream, you risk a systemic cytokine storm that can be fatal. You can't just give it to people. But the Columbia team did something brilliant. They packed the mRNA for IL-12 inside an exosome and turned it into an inhalable mist. Because it was inhaled, the exosomes went directly to the lung tumor. Because they were exosomes, the cells absorbed them and started producing IL-12 right inside the tumor. It turned a cold tumor hot, attracting the immune system to kill the cancer, but crucially, the IL-12 stayed in the lung. The concentration in the rest of the body was negligible. They effectively turned the lung tumor into its own vaccination site without poisoning the patient. That is the power of local, targeted delivery. However, getting the drug to the lung is only half the battle. You have to get through the mucus. For cystic fibrosis patients, the mucus is thick, sticky, and negatively charged. Most synthetic nanoparticles get trapped in this mesh, like a fly in a web. But nature has solved this problem. Exosomes have a slightly negative surface charge and a hydrophilic or water-loving outer shell. This allows them to slip through the pores of the mucus barrier with much less resistance than synthetic carriers. They are naturally mucopenetrating. Furthermore, there is a physics problem with inhalation that most people don't think about: shear stress. To turn a liquid into a mist, you have to push it through a nebulizer. Vibrating mesh nebulizers or jet nebulizers create violent forces. These forces can rip synthetic liposomes apart, spilling their cargo before it even enters the patient's nose. But exosomes are tough. Their lipid bilayers reinforced with structural proteins called tetraspanins, specifically CD9, CD63, and CD81. These act like the rebar in concrete. Studies confirm that you can blast exosomes through a nebulizer, and they come out the other side intact, with their cargo safe and their surface markers functional. This means this therapy doesn't require a hospital visit. It can be done at home with a standard nebulizer. Beyond cancer, this technology is offering hope for idiopathic pulmonary fibrosis, or IPF. This is a disease where the lungs progressively scar until they can no longer function. Current drugs only slow the decline. They don't stop it, but researchers are now using exosomes derived from mesenchymal stem cells. These exosomes carry a secretome, a cocktail of regenerative microRNAs like MyR21 and LET7. When inhaled, these don't just block inflammation. They signal the lung tissue to stop producing scar tissue and start repairing itself. In animal models, inhalation of the stem cell soup actually reduced collagen deposition and improved lung function. It is regenerative medicine without the need for a stem cell transplant. We saw another glimpse of this potential during the COVID-19 pandemic with a candidate called ExoCD24. This therapy used exosomes enriched with the CD24 protein. CD24 acts as a brake on the immune system. In severe COVID and ARDS, the immune system overreacts and floods the lungs with fluid. Inhaling ExoCD24 tells those immune cells to calm down, quelling the cytokine storm and preventing the tissue damage that kills patients. So if this is the magic bullet, why isn't it in every pharmacy? The bottleneck is manufacturing. You cannot make exosomes by mixing chemicals in a vat. You have to grow living cells, billions of them, and harvest their secretions. Traditional 2D cell cultures, growing cells in flat flasks, are horribly inefficient for this. You just can't get the volume. The industry is currently pivoting to 3D bioreactors. Specifically, hollow fiber and stirred tank bioreactors, where cells grow on tiny microcarriers floating in suspension. This 3D environment doesn't just allow for higher density, it actually changes the cell's behavior. Cells grown in 3D often secrete 10 to 100 times more exosomes than cells grown on flat plastic. It mimics the body's natural environment, making the cells more productive. Once you have the broth, you have to clean it. This is purification purgatory. You have to separate the tiny exosomes from cell debris, proteins, and waste without destroying them. Old methods like ultracentrifugation are too slow and can damage the vesicles. The new gold standards are tangential flow filtration, or TFF, and chromatography. TFF works like a microscopic sieve that continuously filters the liquid, allowing for the purification of liters of product at a scale that makes commercial production actually feasible. We are entering the era of cell-free cell therapy. We have realized that for many diseases, we don't need to transplant the stem cell itself, which carries risks of rejection or tumor formation. We just need the message the stem cell sends. By packaging that message into a nebulizable, naturally engineered nanobubble, we are moving toward a future where a patient with lung cancer, fibrosis, or cystic fibrosis can sit on their couch, put on a mask, and inhale a mist that programs their own body to heal. The regulatory agencies like the FDA are still writing the rulebook, trying to figure out how to standardize these complex biological mixtures, but the path is clearing. Inhalable exosomes are not just a new drug delivery system. They are the next step in the evolution of respiratory medicine.